Hello friends, I am Rashmi. Welcome to SRS Info. Today, 25th September 2021, we celebrate the World Pharmacist Day, and the theme for this year's celebration is Pharmacy Always Trusted for Your Health. I would like to discuss some aspects of this theme of World Pharmacist Day 2021. Before going to the details of the theme, let us understand about the organizing institution of World Pharmacist Day. The World Pharmacist Day is organized by International Pharmaceutical Federation, that is FIP, which is headquartered in Hague, which is in Netherlands. And this FIP was established on 25th September 1912. But FIP started to celebrate the World Pharmacist Day since 2009 after the Istanbul Conference. And FIP works with the motto that is Advancing Pharmacy Worldwide. The main purpose of the observation of the World Pharmacist Day is to praise and acknowledge the role and contribution of pharmacists in the healthcare sector globally. Basically, the pharmacist plays a very important role in the healthcare improvement of the global population. And FIP represents over 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators all around the world. So this day is really worthwhile to praise and acknowledge the role and contribution of these healthcare workers. And the celebration of this day encourages to increase the awareness of pharmacists' role in healthcare, and it also helps to enhance the community involvement of pharmacists on national and local levels. The national and local level involvement of pharmacists for the community healthcare system is also improved by this observation of World Pharmacist Day. Now, let us understand the aspect of the theme of 2021, that is, Pharmacy Always Trusted for Your Health. And in today's pandemic situation, this theme is very important. The trust is the only factor which keeps humanity today in this very distrusted environment of pandemic. Trust is a central part of all human relationship and a fundamental element of social capital. Without trust, humanity cannot go ahead. Trust is very essential to healthcare also. There is a close relationship between the trust in healthcare professionals and healthcare outcome for the patient. The recovery of patients is closely related and based on the trust of the patients on their healthcare providers, on their doctors, on their nurses, the pharmacists, other technicians. All the healthcare sector is responsible to provide a trust to their patients for their speedy recovery. Different researches conducted all around the world provide the significance of higher trust of the patients in their healthcare professionals. This is the research findings that higher the trust, higher the recovery. Higher the trust, speed recovery is possible. FIP also promoted the trust of the patients on their pharmacist. That's why they quoted as molecules become medicines when pharmaceutical expertise is added. Pharmacists are not giving the molecules or the chemical compounds to the patients. They are giving medicines with the touch of trust and love. That is the importance of pharmacists in this pandemic era. Pharmacists have been working brilliantly and continuously for keeping the trust of millions of patients to improve and maintain their healthy living. We are not only focused on the disease, we are focused on the healthy living. That is why pharmacists are unique. According to a recent survey, pharmacists, educators, and scientists have been named among the top 5 trusted professionals in the world. Pharmacists are on the top. So, how important is trust in the healthcare service has been explained here. And this trust can be developed, or the trust is possible on the basis of 3 necessary elements. What are they? These are the elements: positive relationship, competency and expertise, and consistency. Let us understand detail about these factors. Positive relationship. Of course, the positive relationship is the base of the development of the trust, and the trust is converted into a smile, a belief that yes, I am recovering, I am going back to life. This spirit can be given to the patients only by the positive relationship. This can be possible by the effort and interest of pharmacists. The genuine interest of pharmacists in the patients and the time taken to listen their words and needs. This is important. Pharmacists are taking proper time to listen their patients, to clear their doubts and fulfill their needs. These play a very important role in establishing a positive relationship with patients. The extra effort taken by the pharmacy professionals during COVID-19 pandemic is the best example for the truthful connections of pharmacists with humanity. And again, the humanity is based on trust and love. So, how important is positive relationship? Next is competency and expertise. Only trust can do nothing in the healthcare sector. For the recovery of patients, we need competent healthcare professionals. And this competency is enhanced through academical studies, internship, professional training, etc. And in many countries, and in India also, we have highest academical courses like doctorate in pharmacy to make the pharmacist as academical expert. Along with the academical expertise, we need practices. Competency is an ongoing element of growth through practice. We need practice, and through the practice, we are growing towards perfection, towards competency. And competent pharmacy professionals are the worthful asset of humankind. Next is consistency. We have positive attitude and we are expert, but we also have to be consistent. Only consistency can make the professionals accessible to the society. So the pharmacists are one of the most accessible healthcare provider in the world, and this accessibility is possible only because of the consistent effort to demonstrate their skill and caring towards patients. So these are the most important elements which promote trust in the healthcare sector. In the patient and pharmacist relationship, the patient-pharmacist relationship is based on the trust built over time, not by some days or some years. It has been created through the effort of many years, the effort of a long time. The public trust on the pharmacist, the government and non-governmental organization trust on pharmacy professionals, and healthcare system trust on pharmacists. The public trust their advice. The government and non-governmental organization trust to provide and expand their service to public regarding health, vaccination, education, etc. For this purpose, government and non-governmental organization required the advices and competency of the pharmacy professionals. And healthcare system trust on pharmacists to find solution for medicine shortage, quality assuring matters, etc. And this is very much important in the hospital healthcare system. We have discussed a lot about trust. Why trust is important? Why trust is important in the healthcare system? Trust is important because trust is the reservoir of goodwill for future. We are more conscious about health because we need a bright future. So without trust, we cannot have that bright future. Now, the world community is passing through the time of distrust, which is spread by the COVID-19 pandemic and the confusing, false, and fearing information spread about it. This is the most dangerous effect of this pandemic time. And in this time, this much of dangerous situation, pharmacists can play a very important role, and they did it also. Pharmacist has built a big reserve of trust and support by the continuous caring and excellent practices. At a time of uncertainty and when vaccine hesitancy remain a major hurdle, public trust in pharmacy is in a highly demanded phase. This is the phase where public trust highly on the pharmacist. Higher the trust, speedy the recovery. Both in the community healthcare system and in the hospital healthcare system, pharmacists play a very crucial role. Let us have a look into the community healthcare system. The pharmacy professionals all around the world have continued to provide direct patient care and perform frontline duties for their communities during pandemic, despite different types of restrictions. These restrictions are applicable to everyone, but pharmacists did their best to face this pandemic, and they have been continuing this effort for the last few years, especially to face the pandemic situation. And community pharmacists are the most accessible healthcare practitioners. But a very unfortunate matter is that the pharmacists are not universally being recognized as the frontline healthcare workers. Basically, there is no universal definition of what a frontline worker is. There is no definition. Due to this lacking of definition, it leads to an inconsistency on how to further classify the essential healthcare workers globally during pandemic time. This makes the classification of pharmacists again more complicable, and they have not been recognized yet as the frontline healthcare workers. And this situation should be changed. During this pandemic time, a very few countries have provided some extra support to the effort of pharmacists for their extra hours of duty, their courageous approach to help the patients, to help the communities, to help the poor and needy one in this pandemic time. Very few countries have provided extra remuneration to pharmacists. One example is New Zealand. New Zealand is the best example to provide remuneration to pharmacists. But unfortunately, many other countries, a lot of countries have not recognized pharmacists as the frontline workers. Even India has not recognized them as frontline workers. This situation should be changed for the better service delivery to the patients and also for the encouragement of the incomparable contribution of pharmacists to the society. There is no substitute for pharmacists in the healthcare system, so they should be recognized and acknowledged. The community pharmacists have some major or key responsibilities towards the community. The main responsibilities are they have to provide accessible healthcare services, they have to practice accessible healthcare supporting system, and they have to clarify the misconception of public regarding the medicines, their use, their time, their side effects, etc. And they have to renew the chronic medication of patients, timely updation of the renewal of them of the medicines by the patients. These are coming under the responsibility of community pharmacist. And telehealth services plays a very important role to update and to continue the necessary medicines to the patients in this pandemic situation. So these are the main responsibilities of community pharmacist. Along with the community pharmacist, the hospital pharmacists also play a very crucial and important role in the healthcare system. Hospital pharmacy services are also very much appreciable all the time, and they participate in antimicrobial stewardship program. That means they supervise the antimicrobial dispensing, antimicrobial issues to patients, the rational usage of antimicrobials in the hospitals, by which they are directly involved in planning and responding to pathogen outbreaks in the hospitals. This is the true fact that the pathogen outbreaks of hospital is caused by the irrational usage of antibiotics, and this can be supervised and controlled by the pharmacist. And they are involved in monitoring the use of antibiotics, explore the new drug therapies or uses, and provide medication management recommendation to their colleagues, even to doctors. The hospital pharmacists have that much of responsibilities to provide correct information about the usage of antibiotics, to control the usage, and to provide the medication management recommendation to their colleagues. Even though the hospital pharmacists are the key players of the hospital care management system, they are not recognized as the frontline healthcare workers. Again, like the community pharmacists, the hospital pharmacists are also not recognized as the frontline healthcare workers. The recognition of hospital pharmacists as frontline healthcare workers will enhance the trusted relationship between the patients and pharmacists. If we have to develop and continue this relationship of the pharmacist and patients, then we have to encourage the pharmacist also. For that, we have to define them as a part of the frontline healthcare system. And this will further grow up towards a healthy society. If we will succeed in maintaining the good relationship with pharmacist and patient, of course, they will grow up, they will add towards a healthy society. Hospital pharmacists have a lot of responsibilities. The major ones are they have to make assured the availability of vital and essential drugs in the entire patient care areas of the hospital. This is the most important responsibility and duty of the pharmacist. And manage the drug shortage, become medication experts. If they are expert, then they can advise or recommend with expert suggestions to their colleagues so that they can manage well. Then they can develop the treatment protocols for chronic treatment, then pandemic medication management, And this pandemic medication management is being done very cleverly by the pharmacists during this COVID-19 pandemic. Antimicrobial stewardship program, one of the flagship program of pharmacists. Then update the recent changes and achievements in the pharmaceutical industry. And this updation is very important to make the pharmacy professionals as competent to give the best service to their patients. And they can develop and maintain interdepartmental communication for the inclusive approach towards the patient care. We don't need the compartmental approach. We need inclusive approach for the inclusive development of the healthcare system within the hospital, so that the maintenance of interdepartmental communication is very important, and pharmacists can do a very important role for maintaining this interdepartmental communication. So these are the major responsibilities of hospital pharmacists. With this explanation, we get an idea about the importance of pharmacists in the healthcare sector in global level, so that we can simply say that the pharmacists are the soldiers of healthcare system. Pharmacists have stepped up to take more responsibilities according to the requirement of time. They are the soldiers of healthcare system, so that they should be addressed as frontline workers and given the recognition they deserve. I think this recognition will be possible very soon because the pharmacists are always trusted. Once again, wish you all a wonderful World Pharmacist Day 2021. Hope you enjoy this video. Thank you.